We're back with Charles Bender, and as I mentioned before, we gave him the vitamin K in order for us to have sufficient electron donors circulating before we give the oxidative therapy. And so in that way, we reduce any sort of side effect or negative impact of the therapy. And now he's receiving the vitamin C. And to a lot of people, it's a shock to hear that we're using vitamin C as an oxidant, because most of the studies published on vitamin C are about its very incredible antioxidant capability. But at the NIH, a number of researchers led by the head of research of the NIH, and his name is Mark Levin, he's published 6 or 7 papers on the fact that we need to review the whole principle of vitamin C and how it works. Because he was able to determine that at very high dosages and provided in a very short time, that is when the drips actually go very, very fast. It has to go at 1 gram per minute. So in his case, we're giving him 30 grams, and the 30 grams are going to go in 30 minutes. It's a very, very fast solution. That's why it's almost done in this very short period of time. And when you give vitamin C in very high concentrations, in the presence of oxygen, it will produce peroxide. And peroxide is the actual killing agent for malignant cells. Now, if we have a lot of oxygen all over the body, why is it not damaging to the rest of the body? Is because we produce incredible amounts of enzymes that neutralize peroxide. But the tumors don't have that capability. And so we have prepared him with the vitamin K and oxygen. When you see the other video from him, he had oxygen, so that we know that we have all the oxygen available and the electron donors from the vitamin K. And now we can do very high dosage vitamin C as chemotherapy. That's the capacity of vitamin C in very high dosages to kill tumors is very similar to chemotherapy. And you can find all of those publications by Mark Levin and his group from the NIH, and some of the reports also have been published from the NCI, the National Cancer Institute. So vitamin C, we've used vitamin C for many, many years as an anti-tumor agent, but we thought, because nobody had this information until very recently, from 2005 were the publications, that we found the mode of action of vitamin C as an anti-tumor agent. We thought from Linus Pauling to 2000 that it was the antioxidative capability. But no, it's exactly the opposite. It's because in very high dosages and given in a very short time, you will have an oxidative process going on with vitamin C. And so that just proves the point of what we learn in pharmacology. Pharmacology 101 teaches you, well, for those of you that are not in America, 101 means the most basic study of pharmacology. We are taught always that the difference between the venom and the cure is not the element, but the dose. In other words, water can be benign in certain amounts and can be deadly for you, the same water, in very high amounts. And the same happens with any element. At certain dosages it will work in one way, and at different dosages it works in a different way. And so this is what happens with vitamin C. At very high dosages and provided in a very short time, it actually produces peroxide, and thus it is an oxidative agent. Also, we use vitamin C in different dosages as a detoxifying agent after chemotherapy, for instance, or radiation therapy. Why? Because the way those elements work is through the production of free radicals, especially radiation therapy. And so we use then vitamin C as an antioxidant, as most of us know it. And the results have been very, very good. Right. What I can tell you, for instance, in a study that we did, 5-year continuous study, we found that vitamin C in high dosages, patients that receive vitamin C in high dosages, using it as chemotherapy, we have a 20-fold survival rate in comparison to conventional therapy. So in cancer of the lung is where it's most effective. In cancer of the colon, it's only 2-fold. In cancer of the breast, it's about 3 to 4-fold. Still, it's very impressive, but it doesn't work for all patients. So what does that mean? It means that with conventional therapy, usually less than 1% of the patients that were diagnosed with stage 4 cancer of the lung are alive after 5 years. With our therapy, about 20% of our patients are alive. And a lot of people say, well, 2 out of 10 is nothing to write home about. It is. It is when the alternative is 0.
Because
so,
it's you, it's not the
yes. So it is very significant. And as I tell you, with cancer of the breast is about 4 times better than just conventional therapy. And we also have one where we use chemotherapy and vitamin C, and the results are even better than that. Not significantly more, but still better. So there are some cases where we feel that chemotherapy is the treatment of choice. In some advanced cancers of the breast and some advanced cancers of the ovary, we still see better results with chemotherapy than with vitamin C. But in other tumors, prostate, and lung, much better results with vitamin C than chemo. And obviously our aim, and what we're trying always to do, is to fine-tune our least aggressive therapies to the point that they can compete with aggressive therapies. For 2 reasons. The main one is, if you have something that works as well that is not going to be toxic, all the better. And the second one is that a lot of the patients that come here have received so much chemotherapy or radiation therapy that it's not an option anymore. And so we have to find something for them.